Hello, everyone, and welcome to Outsmart the Care Catch-22, a guide to efficient and effective healthcare. I'm Carolyn Reginato, Marketing Specialist for Voice and Data Networks, and I'll be the moderator for today's webinar. Our webinar today is sponsored by Plantronics. Be sure to stay until the end of the webinar because we're going to be giving away a Plantronics Voyager Legend CS headset. All right, so today we'll be discussing the challenges and objectives in healthcare and how Microsoft Lync streamlines communications between doctors, nurses, patients, staff, and family to improve patient outcomes. We'll be showing you some real-world use cases of how Lync is being used in healthcare today, and also show you how you can get started with Lync in your hospital or clinic. If you have questions throughout the presentation, feel free to type them in the chat box and we'll answer them at the end. We will also have a poll towards the beginning of the presentation. Type your answer 1 through 6 into the chat box on the right. I'd like to now introduce our speaker and Lync expert, Frank Kania.
Good afternoon.
Frank is the Chief Technology Officer here at Voice and Data Networks and has led many large Lync projects in a wide variety of industries. His mastery of Lync combined with his background in telephony bring a unique and holistic perspective to your hospital or clinic. And now I'll hand it over to you, Frank.
Thanks, Carolyn. Well, if you'll advance the slide, we'll get started. I wanted to underscore a couple of themes, I think, for most of us that have either worked in healthcare or spent a good deal of time around healthcare, have become well acquainted with studies that speak to the relative capabilities, abilities, and state of healthcare in the U.S. And what's stated here in the slide, while a relatively new study, I think it was published just a month or two ago in the Washington Post, actually. So it's received some airing, and I imagine if you want a copy, you can reach out to us, and Carolyn can facilitate getting you a reprint of it. And it raised some interesting challenges. The study essentially said that the greatest barriers or challenges to making healthcare more effective in the United States and less costly would be timely information, coordination of care, and dealing with administrative hassles. And I thought to myself, gee, I don't think these could possibly be new themes. So there's another paper, if you want a copy of, I'd be happy to facilitate you getting it, from the Institute of Medicine. And it's entitled Crossing the Quality Chasm, a New Healthcare System for the 21st Century. It harkens back to March of 2001. And one of the statements in there is, faced with such rapid changes, the nation's healthcare delivery system has fallen far short in its ability to translate knowledge into practice and to apply new technology safely and appropriately. And what it said was really foreshadowing, because it's exactly what we're going to talk about today. It said the healthcare system is poorly organized to meet the challenges at hand. The delivery of care is overly complex, often uncoordinated, requiring steps and patient handoffs that slow down care and decrease rather than improve safety. And these cumbersome processes waste resources, leave unaccountable voids in coverage, lead to the loss of information, and fail to build on the strengths of all healthcare professionals involved to ensure that care is appropriate, timely, and safe. And then I came to another article, just to illustrate the point, because we're going to hit on these core themes throughout our presentation today. This is a blog posting. We can get you a copy of this also. And it says, improving patient engagement with timely, relevant information. You're going to begin to see a theme here. And what they saw is they said the volume of patients combined with multiple shifts between care providers and the lack of timely, coordinated information puts patients at risk. And it's a significant financial impact on the hospital in question. It said 1 in 5 Medicare patients discharged from a hospital. Approximately 2.6 million seniors is readmitted within 30 days at a cost of over $26 billion every year. So those are some telling statements that illustrate exactly what we wanted to talk about. But what we're also going to talk about is we've got a complex regulatory environment. I grew up in a family of healthcare practitioners and executives, so I got regaled at all hours of the day and night with the challenges of healthcare, and being a tech geek that I am, in my propeller, I was saying, boy, these challenges are clearly not new. They've been around for as long as I can remember. But what we're talking about now, when I think about the Affordable Care Act, we're talking about creating information-driven healthcare ecosystem using advanced tools and analytics and building an IP platform that can address that expanded scope of services. So that's really key. So when I always think about it, for me, we hit on some of the key themes already, and I thought when I came across these articles, they were especially germane, because we're talking about handoffs, we're talking about all sorts of things that we all know and accept as common everyday challenges. The concern about safety, promoting quality, being effective, not just being efficient. Efficient's doing a lot of something. Effective is doing the right things in achieving the desired outcomes. And so we're going to talk about that. And I can think of my own experience when my wife and I had our first child, and we're in the hospital, and she had a C-section, and I think we were in 7 days. I was there just suffering alongside. But what I can absolutely say is, she was in the hospital 2 days longer because her physician was simply too busy delivering other babies to dictate discharge orders and so on and send her on her way. And I thought, boy, there's really practical things that we can do to solve those challenges and bring all the caregivers, the allied health professions, nursing staff, and so on together to deliver on a coordinated plan of care. And that's exactly the theme that we're here to talk about today. I think we have some questions, and I think you're going to see the polling slide, but I'll read them to you. What is your most important objective today? 1, to reduce medical errors and promote patient safety. 2, to integrate and transfer medical information from various systems. 3 is to improve real-time collaboration amongst care teams. 4, connect IT at the hospital with remote environments. 5, enable effective communication between caregivers and patients. And 6, support staff training and continuing medical education.
So if you would, please type 1 through 6 in the chat box on the right.
When you feel we've gotten a sufficient pool of answers, we can move forward.
Sure. It looks like so far improving real-time collaboration amongst care teams is the #1 objective for healthcare today. Very good.
Well, that makes a lot of sense, because I would tend to agree that would be a very achievable goal. And interestingly enough, so we talked about this challenge, and when I was mentioning this blog posting that I have, there's a number of key themes that they address, and like I said, and same with this one that I mentioned from 2001 about bridging the quality chasm. And one of their key themes was knowledge is shared and information flows freely. So those are, key things. And what we're talking about when we talk about being effective and efficient, we're talking about the ability to anticipate needs, and also their 10th goal, cooperation amongst clinicians. So that let's build on that. So what we're going to talk about Lync, whether in fact you've ever come across Lync, I imagine if you haven't, or even if you have, everyone's probably has a very different definition of what Lync is and what it can do for them, and quite frankly, even how it might be implemented. But we like to think of Lync, and we've defined Lync as a suite of tools and capabilities that assist you in sharing and exchanging information, bringing resources together for effective use as a means to deliver better patient outcomes. That's what Lync is all about. And what we're talking about that is weaving communications, that most essential element of caregiving, into the tools and applications that people use to get their work done every day. So that's really the key element of it. Does that mean a single inbox for all communications, seamless transitions between email, IM, voice, and video conversations, as well as content sharing and application sharing, and extending line of business applications and enriching them with integrated presence. So we're now talking about the ability to, for example, use document repositories, but not only in reviewing items in that document repository, be able to interact with the author or contributing parties in real time. And more importantly, we're talking about access from mobile devices, the ability to take your Android or iPhone device, your Surface or your iPad, and be able to take all of the tools and richness that comes with that mobility environment and extend it to enable voice, video, conferencing, both audio, video, and content. When we're talking about efficiency, it's really worth understanding that you can build all of this on top of existing infrastructure. It is not a case of grip and rip. You can consolidate and integrate with a whole host of different platforms for savings and simplicity, and also pair it with cloud-based as well as premise-based elements of the very same solution. So, for example, you could have email in the cloud and Lync on-premise and CRM hosted and so on, and be able, and combine this with EMR and so on, and do it in a way that's seamless and transparent to all of the users, no matter what their role or their location. And most importantly, from an administrator's perspective, one common set of tools and capabilities across the entire ecosystem. But when I talk about this, and there's another study out worth reading, it's from Forrester Research. We can get you a copy of that also. It's called The Total Economic Impact of Microsoft Lync. It is quite good, and it deals with many of the elements surrounding Lync, the different models that you can do in terms of on-premise, hosted, and hybrid, but also the ability to leverage existing investments you've made in your communications infrastructure to deliver a high-quality, versatile, and highly secure solution set to your customers and your constituents. So the beauty of this thing is there's nothing that you need to sacrifice, and there's nothing that you need to throw out. So, and this is something that lends itself very well to an incremental approach. You can start out small, introducing such capabilities as IM and presence, and grow to conferencing, video, and so on over time with minimal incremental investment and risk in doing so. So let's get to where the rubber meets the road, and that's, how is it going to improve healthcare outcomes? Because to me, when I think about this stuff, how is it going to help me get people well faster and keep them well? So that's, and one of the key themes that everybody here said resonated with them, and nearly every study and blog post I've ever come across on the topic deals with care team collaboration. And that is, how do we improve caregiver to patient communication, outpatient scheduling and follow-up, medical training and education, and care team collaboration? And it is an interesting thing because you're going to see that the overall perception of quality insofar as patients are concerned has a lot to do with timely interactions and follow-up. So one of the things we noticed is, when I was reading this study back from 2001 and the blog post here and the study we reference here, which is, like I said, fresh out, the team-based approach to care decreased healthcare costs by over 60%. And when we're talking about caregiver collaboration, we're talking about the physician that is looking for someone who is available to discuss a possible diagnosis in a consultation. And there's an application called Lync Mobile that allows just that. We're talking about the ability to leverage communication portals to find an available intern based on presence-based information, because geolocation, meaning where someone is relative to a given incident or need or skill set, can be obtained so that I can know that if I need a thoracic consult, I can do that, and there is a resident that's in the facility at that time that I can tap into to get what I need in a timely fashion. Furthermore, we can weave in other tools like Epocrates and other handheld tools that physicians use to ensure that, for example, drugs that are about to be prescribed might be on a given individual's formulary with their insurance carrier. So what this most important is give an opportunity to do those sorts of things, minimizing the transitions, the user interfaces, and shallowing up greatly the learning curve. So when you talk about determining availability, you hear a lot about the word presence. People always say, well, what does presence mean? I'm going to get bothered all the time, anywhere, anytime? Well, obviously, that'd be counterproductive. Presence actually means, in our definition, the willingness and ability to be accessed on the device of choice. And while that might sound like semantics, it's not. There's a lot of rules and logic to determine how I can be reached, when I can be reached, by whom I can be reached, and on what device I can be reached, which has everything to do with having the right information in the right place with the right people at the right time. So we're talking about the ability to launch a video conversation, quite simply. And here, remember, we can elevate different forms of communication, what Microsoft or those of us that are practitioners of unified communications like to call modalities, to be able to move from one modality, instant message or a chat session, to a video call with real-time voice and video, to application or content sharing in real time. So you can, so we're going to see that in a very practical way with the next case example. Because one of the things that, my parents were always doing is we were always engrossed in some sort of continuing education. And as we said, with all the advancements in health sciences, I'm saying this is critical stuff. And when you see it, it's not going to be too terribly shocking to you. We're talking about the ability, for example, to be able to work with students and other caregivers on things like reviewing of an X-ray. So we're going to be able to make determinations about it. I think you can advance the slide, Carolyn, and determine, I think that's somebody's spinal, is that the brain or the spinal column? I can tell you that apparently my anatomy skill might be somewhat lacking. That looks like somebody's thorax to me. But we're going to be able to look at like the pleural effusion or the hilar adrenopathy, and you're going to be able to make those determinations and discuss in real time what it means and what the appropriate therapy for a given patient might be. In fact, even vote perhaps much as you did today. And more importantly, this can be recorded in real time in all its different modalities so that it'll play back much as it unfolded. So these can be later stored and made available for self-help and for remediation, so people can go back and look at it later and refresh themselves. And then the last key of this thing, which I think is really key, and that's outpatient scheduling and follow-up. Lots of studies out there. Again, I have some of them, and if any of you are interested, we can get you access to that. But one of the greatest costs when you talk about reducing cost and improving efficiency would be reducing, for example, patient no-shows. And we can improve those by upwards of 30% as a result of findings by Johns Hopkins and the University of Rochester, which is a very interesting study to read, by the way. It won't put you to sleep, I promise. What we're talking about is being proactive in how we interact with patients. But more importantly, when I think of all the developments surrounding the Affordable Care Act and stuff, is that patients be an integral part of any treatment plan. So we're talking about the ability to send educational information. Remember when I talked about the importance of being proactive, the importance about having timely information, the ability to be equitable and effective in what we do, leveraging scientific knowledge, we're talking about that ability to get people well and keep them well. Think about educational information, reminding patients of test requirements, having people pre-registered for appointments to save time and reduce staffing commitments. And we're talking about things like improving patient times and allowing caregivers to function more effectively and spend more time with a patient, but more importantly, capturing lost staff and physician time by automating patient communications. Physicians get to spend more time on providing quality care and collaborating with their colleagues, and patients get more timely notification and actionable intelligence about their own care.
We have a question coming in. So it says, anytime there's a discussion of using mobile devices for healthcare, security concerns are overwhelming. Bandwidth is an issue. Can you speak to more practical solutions to these problems?
Well, a couple of things to note about Lync. Lync is fully encrypted beginning to end in all modalities, so that it is worth, I won't bore you with all the technical things, but it's TLS or MTLS, TLS server to client, in MTLS server to server. So it's in fact one of only 2 voice over IP communication platforms that have passed the defense interoperability to the command. So it's from a security perspective, I think we could allay those concerns. That's not to say that devices can't be co-opted and other things. There are other protocols from a physical security perspective that also need to be addressed. And when we're talking about bandwidth, aside from a video, and video can be a rather large consumer of bandwidth, overall, Microsoft has developed very adaptable codecs for voice and AV communications that are very efficient. Whomever asked Carolyn if you'll get that and record that information, I'll make sure that I get you information so that you can understand what the bandwidth utilization requirements are. And I think by and large you'll find them to be much less than you might at first believe. So I'm happy to pursue that because I think it's a very fair concern to have, and I think Lync addresses them very well and without forgoing quality. So they've done a very good job because Microsoft, not being in the networking business, primarily spends its time in the middleware space, and as a result has to be accommodating to networks of varying, capabilities and quality. So let's talk a little bit more about, but keep the questions coming, and I'll pledge to attend to them as rapidly as I'm able. Proactive patient engagement, what I really like to think about is getting people into the system quickly and efficiently, delivering a high-quality experience that's care-focused and aimed at preserving wellness and obviously preventing readmissions. More importantly, though, I think that timely access and proactive communication greatly improves patient adherence to their care plan. And I can speak to that personally. I'm the world's worst patient. And as a result, I tend to not necessarily follow the instructions that I've been given and usually exacerbate whatever situation I have, and for the negative. And so I have, found that, that kind of follow-up, and a few of my physicians have adopted it, while shocking at first, had a lot to do with my making better and more informed and educated decisions about my care and convalescence. And I'll tell you, the outcomes were markedly better. And this speaks immediately to freeing up appointments and making more time available for new patients. And we all, I think, have experienced the access to health care issue, in which, in the end of the day, speaks to the bottom line in terms of both profitability and return on investment. So I think we've given some attention to caregiver to patient communications, but I'll tell you, this is the area that I think really, gets a lot of lip service, but very little tangible benefit. save for someone calling me up from my physician's office to say, your test results are normal. Those that know me would argue that there's not that much about me that's normal. But even if the, test results were, oftentimes I have questions and other things that come to mind that can't be addressed effectively by the person who's been tasked with calling me and delivering the news. So what you're going to find is 48% of employers plan to offer telehealth services. I think it was on public radio yesterday, on national public radio on my commute to work, that Walmart's going to put clinics in, I think, 12 or 13 of its stores for its employees, primarily in the southern states, and they felt that it would significantly improve worker productivity, reduce absences, and reduce cost to their 1 million, roughly, healthcare plan holders. And I thought, that's a phenomenal thing. I mean, that's really tangible. And when we're talking about telehealth, which is very popular and growing along with telepharmacy and now, telemental health services, a lot of folks, and what they said, I think I read a study that most people that have a chronic disease have 3 or more chronic diseases. And what they said is, when you talk about the ability to use telehealth to aid patients, you're talking about all the things I talked about, being proactive, giving people actionable things that they can do to impact their health in a positive way. Saw sharp reductions, 51% in fact, in hospital readmissions related to heart failure at a savings of $10.3 million. And earlier we just talked about readmissions for patients discharged resulting in a cost of over $26 billion every year, and that was as of January of this year. I thought, that's incredible stuff. So when you talk about this, it translates into actionable dollars and improved patient outcomes that are not to be discounted. We're talking about improving at-home care. We're really talking about allow people to interact. Carolyn and I were in my office the other day, and I said, I think my doctor makes house calls, my family physician, and we went on his website, and sure enough, he does. And I thought, well, now everybody goes, that dude must live in a really small town, and I do. But what I can honestly tell you is what we're talking about is different modalities to interact with patients, drive out the cost of care, and allow people to connect to specialists for a second opinion, or even deal with more routine day in, day out maladies like an earache or a sore throat, and in a way that's much more effective and substantially less costly than more traditional methods like, the Saturday morning trip to the urgent care. So what we're talking about also, this is especially important with underserved communities and in rural markets, and we tend to spend a lot of time talking about this in the context of rural health care, but there are a lot of underserved communities in urban metropolitan areas where this technology is being leveraged. It is saving time, eliminating travel, improving overall access to people who genuinely need care. And when that care and those needs go unaddressed, result in very costly emergency room visits that tax the healthcare system. So we're really talking about things at the core of improving quality care. We're talking about driving up preventative initiatives and reducing unnecessary doctor visits and, quite frankly, what I would call the more chronic items. So where does IT fit into this whole thing? Because in the end of the day, what we're talking about is, by its nature, technology. And I think most of us who spent any amount of time around healthcare kind of bristle at the notion of reducing people and their medical maladies to technology, or even worse, to dollars and cents. But what we're really talking about is driving revenue by making more effective care possible, reducing readmissions and unnecessary visits, and allowing physicians to spend more time with patients. And when I look at that, I think, physicians are, I'm imagining, in the ones that I talked about, as efficient, meaning working as hard as they possibly can, in not spending, in their eyes, enough time with patients. And what we're going to talk about is doing more with less, which I think is the mantra just about everywhere today, but ever more so when it comes to healthcare. And what we're talking about, and I want to underscore, this is intuitive with a very shallow learning curve, a common interface across every touch point and device. We're talking about empowering physicians and caregivers in compelling and making it easy for them to collaborate. But we're talking about doing it with investments you've already made, and that's really key. So when we talk about this, we're really talking about, well, how much less? What are we going to do? We're talking with savings of up to 60% on the recurring costs for infrastructure, reductions in facility costs, tremendous reduction in audio and conferencing and collaboration and telephony costs, and minimizing travel and unnecessary travel, again, allowing critical folks to spend more time doing what it is that they do and allowing people to benefit from it. So just to underscore the point that I'm not going to belabor this point, but if anybody wants to pursue this more, and we do have one question on it, we'll absolutely get you the necessary information so that you can evaluate the security elements of Lync in depth. So how do you go about doing all this? Where do we go and how do we get there and how do we make this change happen? Because there are some real practical things we can do. Because when I talk about Lync, I talk about Lync as being a catalyst for change. It's transformational. And when I talk about that, what we're going to talk a bit about is how do you get some tools to help you think about this better, and some things that you can do if you're looking to potentially embrace a Lync deployment, ensure that it'll be successful. So when I talked about the total impact of Lync, here are some things from the Forest research study: reduced telephony costs, staffing optimization. But if you think there's some themes again that come right back to the themes that we started out with: improving timely access to information, reducing unnecessary cost, being timely and efficient and effective. So how do you get into this thing? How do you get started? What's in it for you? That's always what I ask people. Well, how do I do it? What's in it for me? Lots of different methods, as I mentioned. You can do a standalone deployment. You can do it integrated with your PBX, or you can replace your PBX. So if you're looking to enrich an experience you already have with investments you've already made, fine. If you're doing Lync for just instant messaging and presence, you can do that, and then you can layer in and introduce these technologies over time. Interestingly, there's no cost penalty for doing it incrementally. So once you know the solution lends itself to that kind of thing. Carolyn, do we have another question?
We do. Are there healthcare institutions already doing these things successfully, and can we talk to them?
There are, and what I will do is ask you to follow up with Carolyn, but there's St. Luke's Health System in Idaho, Advocate Healthcare in Illinois, and Intermountain Healthcare are all organizations that are doing it. We can certainly help broker some discussions with you, if you like. There's a couple of these I've been, integrally involved in past lives, and I can certainly share with you, and also have other people share with you their insights and experiences. And then, we've included in here for your benefit, I think, Carolyn, you'll get some follow-up emails when she does the voodoo that marketing people do, and you're going to get access to some white papers and other things you can download that are going to assist you. But I did wanted to provide some technology checklist, some things to think about Because when you think about this, whenever you talk about any catalyst for change and any paradigm shift, there are both technology and cultural components that you need to consider. So I wanted to highlight some of those, like device strategy, which speaks directly, interestingly enough, to security. So they go hand in hand. The PBX and your communications infrastructure, your network infrastructure and topology, the resilience of your infrastructure, and so on. So those are all things that you want to weigh and consider. And when I said there's always technology or the people element also that needs to be weighed, and where we're going to talk about that, I said, there are some key elements that I encourage everybody looking at anything that involves, a shift in paradigm and changes the manner in which people work and the tools they use to do that work, get some top-level buy-in. You'll need an executive sponsor. It's critical. We have tools and resources to assist you in garnering that kind of attention and making those kind of arguments necessary to get that sort of sponsorship. Requirements definitions, aligning your processes to the technology. You notice I put process alignment. I didn't say you had to go and conform to the technology. The technology needs to conform to your process. It's really important. Hands-on workshops, training, user adoption, the overall success has a lot to do with how it's rolled out and how it's embraced. Developing end-user champions and engaging in pilot program activities, and all of which we can assist you with, even if you choose to do other things differently or perhaps even on your own. So there are some documents you're going to have access to. So I think an email will come and tell you how to go about getting all these things. They're good reads. They're not terribly long. I think you'll find them, meaty in terms of content, but they will not be sleep-provoking. And then what I just want to tell you a little bit about what we do, one shameless marketing plug, and that is we are a provider of value-added professional services, system integration, and managed services. We provide both network-based, on-premise, and cloud-based services, or hybrid solutions, as the case may be, that allow maximum flexibility and different procurement models. We provide voice and unified communications in the contact center, collaboration, and mobility, both voice, video, and data networking, intelligent and cloud-based networks, and terrestrial services such as infrastructure, wireless, and so on. So how does voice and data get Lync done for you? And there's a lot of elements to it, but there are kind of what I would say 4 pillars to do this. And that's the business vision, strategy, and challenges. We call it the understanding phase. Microsoft calls it the envisioning phase, if you had an opportunity to be regaled by any of their marketing rhetoric. Assess and review. That's, where does it fit into the ecosystem you already have? Microsoft likes to call that the art of the possible. And then identify. Pilot schemes, that's where you're going to actually deploy. And then most importantly, as this is a living and breathing thing, you're going to have to measure or assess and refine the solution over time. And we have methods to assist you in all of those, but most important, empower you to do it for yourself. So let's close this out and talk about some actionable next steps, things you can do to get started today. So when I think of it, I said I wanted to give you guys, some folks, something that you could adopt right away. We don't have to spend a lot of time. We do this day in, day out. We've done it in every type of environment, in every type of network, in nearly every vertical on every continent, everywhere. And the beauty of it is we're so good at it, we can put our money and our price where our mouth is and tell you just how much it's going to take to get you started and what it'll give you. So these capabilities, you want a quick start, instant messaging, presence, desktop and application sharing, and audio and video conferencing, you can have it. You'll be hard-pressed anywhere in the industry to find a price like $9,000. You can have an enterprise solution to include telephony capabilities. That's calling within the enterprise and outside the enterprise, anywhere, $14,000. And then we have additional add-on solutions for Microsoft Exchange, Microsoft SharePoint, if you're looking to develop SharePoint into workflows and other things, we can certainly assist you there. And then one low impact, to use the vernacular, outpatient surgery. If you want to look something where you can do little to no harm and offer tremendous benefit, Exchange Unified Messaging is a great way to do so. It's available in 2007, 2010, and 2013 Exchange. Think of it as a universal inbox for email, voice, and email. And it is a surefire way to add real value. You're talking speech-activated menus, speech-activated automated attendant, no more press 1 for this, press 2 for that. Somebody wants patient accounting, they just say so, and off they go. It is very versatile. Everybody can have access to their email and calendar and voicemail messages, both touch tone and speech driven. If you have any other follow-up questions or anything else you'd like to know, feel free to ask them in the chat window. I don't know if you can let everybody just ask or not.
Yep, go ahead. If you have any further questions, we'll wait a couple minutes for those. In the meantime, a couple questions. How easy is it to set up user permissions in Lync for the different roles in a hospital, for example?
Well, Lync, like all the latest Microsoft entrants, supports roles-based access control, so you can easily delegate varying individuals by role or department, for example, to manage different capabilities of the solution as they see fit.
Okay, and what is the level of expertise needed to manage Lync after it's deployed?
One of the advantages of Microsoft Lync that most people like is it doesn't require a lot of specialized skill in order to maintain, nor does it require a great deal of complex or costly training to adopt Lync and care for it in a production setting. So what I would say, very basic, Windows networking skill, if you will, is what I would attribute that someone would have to have in order to be comfortable administering it on any regular basis. Many people often delegate day-to-day moves, adds, changes, and regular and routine management to their help desk. Perfect.
We have a question from Stacy. You had mentioned the report about the total economic impact of Lync. Did you say that report is available to us?
It is. We can get you a copy of it. I believe it's also, you can Google the total economic impact of Microsoft Lync. It's from Forrester Research. It was commissioned by Microsoft, so I will say that outright, as does the report itself. And you need not pay to receive it. I mean, it's available. And it's a rather lengthy study. I would say it's upwards of about 80 pages or so.
Oh, and it looks like she found it. Awesome.
Excellent.
One last question. What kind of licenses are needed for Lync, and how can I find out if I have the right one?
So with Microsoft Lync, it all depends. If you're covered under an enterprise agreement, whether you buy on the open market or what have you, and if you're not quite certain what you do have, you can always reach out to me, and if you'd like me to interpret your enterprise or select agreement for you, I'd be happy to do so. But for instant messaging and presence, you would require the Lync standard CAL, or client access license. You can also buy device licenses too, if you want, but the CALs tend to be overall a better bargain. If you want the application and desktop sharing in video, you better point to multi-point, essentially what a video bridge would do for you. You need what they call the Enterprise Lync CAL. And if you want the PSTN capabilities, essentially the PBX capabilities, that requires what they call the plus cal. All Microsoft CALs are additive, which means in order, for example, to do the PBX replacement, you must have the standard cal, the enterprise cal, and the plus cal. But we can always help you, and if you're looking at a hybrid solution, like with Office 365, then you would need either the E2 or the E3 there, or E4, all depending on what it is that you wish to do.
Wonderful. Does anybody else have any more questions? And with that, that's all. I'd like to thank everyone for joining us today. Be on the lookout for future webinars from us. And if you have any questions, feel free to contact myself, and I will get you in touch with Frank.
Thank you.
Thank you very much.